Hi, my name is Dr. Colin Tamboline. I'm a GP on the peninsula. I work in Sydney. I'm a full-service family practitioner, so that means I do obstetrics as well as palliative care and everything in between. The doctor situation here, like many places throughout our province and our country, is difficult in as much as there's not enough physicians to do the job that we're expected to do. So many patients in our community don't have a family physician, and so that's basically a doctor shortage. Many of the patients who are admitted to hospital do not have a physician who will look after them in hospital. If they have a physician in the community, that physician may not work in the hospital, or if they're one of the unlucky patients who doesn't have a family physician, there's nobody to look after them in the community or in hospital. So those patients get assigned to a doctor of the day. And that doctor is willing to work in the hospital and will look after these patients while they're in hospital until they're discharged. So that Doctor of the Day program has grown out of the need to look after patients in hospital who don't have a physician who works in the hospital. And as it turns out, over the last 5 or 6 years, that has become an increasingly large number of patients. Now it's about at least half, if not 2/3 of our admitted patients to Saanich Peninsula Hospital are Doctor of the Day patients. And so that has put a huge burden on the physicians who are working in the hospital and doing this Doctor of the Day work. So the foundation came up with an incentive idea where they would reward those doctors who are doing this work with extra financial remuneration for doing the work that nobody else is willing to do. I personally think it's an excellent gesture. I really think that it's giving those of us that do Doctor of the Day a real pat on the back, which we need. Without a Doctor of the Day program at Saanich Peninsula Hospital, I really fear that this hospital would be at risk. Because Doctor of the Day patients now comprise, like I say, at least half, if not 2/3 of our inpatients in the acute care unit at Saanich Peninsula Hospital. If we did not have physicians looking after them, they would not be here. If 2/3 of our acute care inpatients were not in this hospital would be severely underutilized. And if it was severely underutilized in today's economic climate, the health authority would be hard-pressed to keep the acute care unit open. The beauty of Saanich Peninsula Hospital and the Saanich Peninsula in general is small is beautiful. You do have that camaraderie, that mentorship, that support from your colleagues and all of the other people that you work with, from nursing staff to cleaners to care aides to foundation. Everybody is on the same team, and you're really working together to try and give the best care possible to the patients you're looking after. And so it's an extremely satisfying place to work. I really feel that this is a gem.